Good morning, Mr. Obed. I'm Dr. Junior. How are you feeling today?
Bonjour docteur. Je ne pas sentir bien du tout, non? J'ai un problème dans l'estomac.
I'm sorry to hear that. Can you tell me more about your symptoms?
Oui, je suis capable. Bon, semaine passée, moi j'ai un pile douleur dans l'estomac. Si tout l'aime fin manger, c'était une sensation boulée. Et moi j'ai senti moi envie vomir et puis me j'ai arrêté tout.
I see. On a scale of 1 to 10, how would you rate your pain?
Li varie, mais moi t'ai qu'à dire d'habitude li entre 6 et 7.
And you mentioned it gets worse after eating. Is there any particular type of food that makes it worse?
Oui, spécialement manger qui épicé ou sinon gras tout. Même mon vieux tical qui déclenché douleur.
Have you experienced any weight loss, fever, or vomiting?
Ni la fièvre, ni vomissement. Mais moi perdu poids parce que je peux manger.
All right. Have you noticed any blood in your stool or dark tarry stools?
Non, moi pas faire ça.
Thank you for sharing that. I'm going to examine your abdomen now. Please lie back on the table. Does it hurt when I press here?
Oui, li tout petit dans zone ça.
Okay. From what you've described and the examination, it sounds like you might have gastritis or a peptic ulcer. However, we'll need to run some tests to be sure. I'll order a blood test and a stool test to check for infections or other issues. We might also need to do an endoscopy to look inside your stomach.
Endoscopie, ça y est.
It's a procedure where we use a thin, flexible tube with a camera to look inside your digestive tract. You'll be sedated, so you won't feel any discomfort. It helps us get a clear view and take biopsies if needed.
Moi comprendre. Est-ce que y a l'autre bagay moi ka fait pendant temps ça pour aider me sentir plus bien?
Yes, I recommend avoiding spicy and fatty foods for now. Stick to a bland diet, things like plain rice, bananas, and toast. Also, avoid alcohol and smoking. I'll prescribe a medication called a proton pump inhibitor, which can help reduce stomach acid and give your stomach lining a chance to heal.
Merci, docteur. Moi, apprécié ça.
You're welcome. Do you have any other symptoms or concerns that we haven't discussed yet?
Bon, moi, te senti un petit peu fatigué dernièrement. Je ne suis pas sûr qu'il y a un rapport ensemble avec ça, non? Même, tu pensé, on a toujours mentionné ça.
Fatigue can sometimes be associated with digestive issues, especially if you're not eating well. It's good that you mentioned it. We'll include some tests to check your vitamin and mineral levels, as deficiencies can contribute to fatigue.
Ça fait un peu de sens. Je te mangé petit, juste assez pour éviter douleur.
I understand. It's important to get to the bottom of this so you can eat comfortably again. Do you have a family history of digestive issues like ulcers or inflammatory bowel disease?
Oui, maman te gen ulcère dans l'estomac, et puis sem nan te gen IBS.
Family history can play a role, so it's helpful to know that. Are you currently taking any medications, including over the counter drugs or supplements?
Mwen pren multivitamine chaque jour, et puis gen de lè mwen pren ibuprofène pour tête fait mal.
Ibuprofen can sometimes irritate the stomach lining, especially if taken frequently. I recommend avoiding it for now and using acetaminophen instead if you need pain relief.
Map chanje.
Great. I'll also give you some information on dietary changes and stress management techniques, as stress can exacerbate digestive issues. Do you have a lot of stress in your life right now?
Oui, travail là te vraiment stressant ces derniers temps. Et puis, moi inquiété à propos de santé tout.
It's a vicious cycle, isn't it? Stress can worsen your symptoms, and then the symptoms increase your stress. We can work on breaking that cycle. Regular exercise, adequate sleep, and relaxation techniques like deep breathing or meditation can help.
M'a ese yo. Merci pour tout conseil yo, docteur.
You're welcome. We'll schedule the tests and the endoscopy, and I'll see you again to discuss the results. If your symptoms get worse or you experience any new symptoms, please contact us immediately.
M'a fait ça. Merci en pile pour aide.
Take care, Mr. Obed. We'll get to the bottom of this.